Today we will talk about different type of OT letters. You can see here they are broadly categorized into two types. First one is when the letter is being sent to a hospital, to an emergency department, to a specialist. In the type of letter which are sent to hospital, emergency department, or to a specialist, routine referral, urgent referral, and transfer. So in this situation, the reader who is in the hospital or emergency department or specialist have no existing relationship, existing professional relationship with the patient. So in that case, we will include past medical history. By past medical history, I mean like any condition which is relevant to the current situation, any medications, patient's lifestyle like smoking, alcohol history, BMI, any allergies, everything which is relevant. So in that scenario, we will include past medical history. The other type of letter is when the patient is being sent to the GP. GP means general practitioner, not general physician. Okay? So when the patient is being sent to the GP, so GP is the person who has existing professional relationship with the patient. Every patient is registered with the GP, and GP knows about patient's past medical history. So in that scenario, we will omit past medical history. We won't include it. Okay. So this type of letter include discharge and update. So next thing, we will go through their structures. Before going through structure, I want to clear something, that there is no specific structure. The one I will be discussing here are the proven and the easiest one. So first type of letter is referral. Referral is again subdivided into two parts. So first, referral is the kind of letter where patient is being referred from the GP to the specialist or emergency department. The reason could be like further management. Further management is a broad term like investigation, treatment, diagnosis, everything. Okay, so it is subdivided into two parts like routine referral and urgent referral. Routine referral is the one when patient is being referred for any non-urgent condition. For example, patient has had diabetes for the last 10 years, and for the last couple of days, maybe weeks, patient blood sugar is no longer controlled. Therefore, you are referring the patient to an endocrinologist for further management. So that is a routine referral. The other type is urgent referral. In urgent referral, so take the similar example. Patient has had diabetes for the last 10 years, and suddenly he has developed diabetic ketoacidosis, DKA. So that's an emergency. So you will refer the patient urgently to a hospital, normally to an emergency department. So that will be an urgent referral. So let's talk about their structures. So there is actually minor difference in the structure. We'll talk about that. First, go through the structure of routine referral. First thing is introduction, then past medical history, then first visit, next visit, today's visit, and conclusion. This approach is called chronological approach. Right? We are starting from the first visit, then to the next visit, then to the last one, like today's visit. That is called chronological approach. I will show you in the sample. And next type of letter is urgent referral. So there is a small difference in their structure. You can see introduction. Immediately after introduction, there is 2 days visit, then first visit, then next visit, then past medical history, then conclusion. You can see here what are we doing. We are actually writing 2 days visit immediately after introduction, and we are moving this past medical history to the end. So what are we doing? We are moving past medical history to the end here, and we are bringing 2 day visit first immediately after introduction here. So that's the main difference. Let's see the sample letters. So this is a routine referral. You can see here, first thing is introduction. Thank you for seeing Mrs. Priya Sharma, type 2 diabetic, for further management of her blood sugar levels. Then is Mrs. Sharma was diagnosed with NIDDM in 1999, has been monitoring her BP and sugar levels at home since then, has strong family history of diabetes, allergic to penicillin. So this patient's past medical history. Next thing is past medical history. Then is Mrs. Sharma initially presented on 29/12/18, concerned that her blood sugar levels were no longer well controlled. So this is the visit which was on 29/12/18. This is the first visit of the patient. So this is first visit. Okay. Then you can see here's the next visit, which is on a pathology report received on 5/1/19, which is the next date. Showed HbA1c level of 10% and GFR greater than 60 ml per minute. So this is the next visit. Next visit or next visits could be more than 2 visits, 3 visits. Next visits. Then is last 2 days visit. So definitely 2 days visit will the recent visit. So today Ms. Sharma's non-fasting blood sugar levels were 7 to 8 millimole per liter, and like this. So, and this is the conclusion as well. Therefore, I am referring Mrs. Sharma to you for your specialist advice. So it also includes conclusion. So this is the structure of our routine referral. Now let's see the differences. Okay, so in urgent referral, first we will start with introduction. So introduction and conclusion are at the same place. Like introduction will be the first and conclusion will be the last one. Like their placement is invariable, okay, irrespective of the type of letter. So introduction. Thank you for evaluating Mrs. Walter, who has been diagnosed with severe depression with a possible bipolar disorder. She requires urgent assessment and treatment. It's important to mention that it's urgent here. Okay. So after intro, you can see Mrs. Walter presented today. So we're writing today's visit here. Today's visit. Then initially Mrs. Walter presented on this date. You can see This visit was on 19/11/14. This is the first visit. Then on the subsequent visit, Mrs. Walter reported feeling well, more energetic, and increased her involvement in school activities. Okay, so this is the subsequent next visit. Then Mrs. Walter is married and has 2 children. This is past medical history, family history, everything. Then is the conclusion. Your prompt assessment and management of Mrs. Walter's depression, bipolar disorder, and suicidal thoughts or ideations would be greatly appreciated. So this is conclusion. So we talked about referral letters. There are 2 types of referral. One is routine referral, the other one is urgent referral. Routine referral is a routine condition the patient is being referred to, normally to a specialist. Okay. And urgent referral is an urgent condition when the patient is being referred to an emergency department. Yes, it could be to a specialist if it's the case of cancer, suspected cancer. We refer the patient urgently to a specialist, to an oncologist or the respective specialist. And we talk about their structure. The main difference is we are actually switching place of today's visit with past medical history. Next type of letter is discharge letter. Discharge letter is the type of letter when the patient is being sent to the GP. So just keep in mind, GP is the person who has an existing relationship with the patient. So in that scenario, we will omit past medical history. So let's see a structure. So the structure of a discharge letter, definitely first will be the introduction. I think this discharge letter has the easiest structure. Why? Because it follows the natural course. Just suppose you are in the hospital, you have admitted a patient. So like first thing will be patient's presenting complaint. Why did patient present to you? And it's his. Then you will evaluate the patient, your examinations, and then you investigate the patient, and then you will make a diagnosis and you will start the patient on some treatment. Then patient's current status, definitely you only discharge the patient, you will mention patient's current condition, and then you will write discharge medication, or if you have any advice, that. So it follows the natural course, how a patient is admitted and what happens during hospital stay and what we'll do when we discharge the patient. So let's see. Introduction, then is the presented complaint, then hospital stay details, which includes let me zoom it in. Examination, investigations, diagnosis, treatment, nursing care, post-op care, whatever. Okay, it does not mean we will write everything. We will write whatever is given in the case notes. Okay, sometimes like examination will be omitted, there will be no examination, there will be no investigation. Okay, we will not be making a diagnosis, patient has already been diagnosed. So in that scenario, examination, investigation, and these things will be omitted. But if they are present, this is the order how we write them. Then patient's current status, then discharge medication, advice, and then conclusion. Let's see a sample letter. So your patient, Miss Taylor, who was admitted for decompensated schizophrenia, is now ready for discharge and follow-up care at your clinic. So this is the intro. Then, at the time of admission, Miss Taylor exhibited pronounced thought disorder, including thought blocking and latency, along with delusion, both auditory command and visual hallucinations. So these are patients presenting complaint. Next thing is hospital stay. This is during hospitalization. So it's not necessary to make a different separate paragraph for everything. Okay, we can write them in a single paragraph, but the flow of order should be like the way I mentioned here. Right? Okay. Presenting complaint, then hospital stay. We can't write hospital stay first, then presenting complaint. So we will lose marks in organization. So next thing was during hospital stay paragraph. During hospitalization, she was reinstated on her medication regime. Her nursing care emphasized assessing for psychosis, redirecting her from delusional thoughts, like that. So we don't have any examination investigation findings here. Patient has already been diagnosed. This is a diagnosed case. So we'll start from we have started the patient on medication and patient nursing care. The next thing is patient's current status. So hospital stay is given here. Okay. Now current status. So Ms. Taylor's mental state has now stabilized. Since 10 March, she has not reported any auditory or visual hallucinations. Like that. We'll write patient's current status. Then discharge medications. Discharge. Okay. So Ms. Taylor is prescribed oral risperidone 4 milligram nightly. Like that. Then conclusion. Following discharge, Ms. Taylor will attend follow-up appointment with you to manage her chronic schizophrenia and to ensure compliance with her medication regime and prevent substance abuse. Okay. So this is the structure of a discharge letter. So next type of letter is update. So update letter is like a discharge letter. This is also written to a GP. So what actually happens in case of update letter? This is the GP. Suppose this is the GP. This is the hospital. Or specialist. GP refers the patient to the hospital or some specialist. So that will be a referral letter. So and that will be a referral letter. During referral, the GP asks the specialist or to the reader in the hospital to update him or her regarding patient's condition. So this update letter is in response to that referral letter. So the specialist or hospital updates the GP about patient's current situation, but patient will not be discharged. So that is why we write an update letter. So update letter, as we talked earlier, from hospital or GP, from hospital or specialist to the GP. GP is the person who has existing relationship with the patient, so we will omit past medical history here. So we'll start with introduction, then presenting complaint. So this is the structure for letter who is being written from the hospital to the GP. So we will have hospital stay details, exactly same like like the discharge letter, examination, investigation, diagnosis, treatment, nursing care, post-op care, okay, whatever. Then current status, if patient's current status is given, definitely we will write patient current status here. Then if we have any further plans or advice for the patient, we write them here. Then conclusion. Actually, there is no sample here for the update letter which is being sent from the hospital to the GP, but we do have a sample for the other one where the patient is being where the letter is being sent to the GP from the specialist. This type, other type, is specialist to the GP. We do have a sample for this one. So let's see structure. Introduction, presenting complaint, then examination, investigation, diagnosis, treatment so far. Because we are in the specialist here and we are updating patient's GP, but we are definitely not admitting the patient. Okay, so we do examinations, investigations, diagnosis, treatment. We'll definitely provide treatment. Then we'll write patient's current status, then further plans or advice, then conclusion. Let's see some. So I am writing to provide you an update of Mr. Matthews, who was referred for treatment of complicated sexually transmitted infection. He is now undergoing treatment and showing positive progress. So this is the intro. Then today, Mr. Matthews presented with fever, sore throat, headache, malaise. Okay. Then examination revealed a temperature of 101 along with a symmetrical, non-itchy pink maculopapular rash, okay, covering his trunk, extremities, palms, and soles. So then examination. So presenting complaint. Then we have examinations here. Then we have investigation, laboratory investigation revealed. Then the diagnosis. Then our plans and conclusion. Here we have conclusion, including if we have any plan, we will write it here. So in conclusion, please, we're asking the GP, please ensure appropriate follow-up, definitely after discharge, with guidance on safe sexual practice, treatment adherence, and potential consequences of non-compliance. To the conclusion. So this is the structure of an update letter which is being sent to the GP from a specialist. And the structure of the other type of update which is sent from the hospital is same like a discharge letter, except we won't write discharge medications. So last type of letter is a transfer letter. So transfer letter is different from other letters. Like in case of referral, patient is being referred from lower facilities, like from GP to higher facilities to a specialist or to a hospital. And in case of update and discharge letter, patient is being discharged, patient's GP is being updated, so it's from higher facilities like specialist or hospital to the GP. But in case of transfer letter, it's between the same kind of facilities, from one hospital to another hospital. The reason could be like patient is admitted in one hospital and that hospital have no facilities for ICU, like NICU, or for rehabilitation or something. So patient is being transferred. Transfer and shift is the same. Shift letter or transfer letter. You get a script letter on exam day, the structure will be the same. So introduction, then past medical history. So in this scenario, we are transferring the patient to another hospital. So the treatment in the hospital has no existing professional relationship with the patient. So we definitely include past medical history. Then presenting complaint, then hospital stay. Definitely we have admitted the patient. We have provided some kind of care, which includes examination, investigation, diagnosis, treatment, or nursing care, whatever. Okay. Then medication. If we are giving patient giving some medication to the patient, we will write the medications. Then conclusion. Let's see a sample here. So this is a sample of a transfer letter. Let's see. Thank you for accepting. So thank you for taking care of Mr. McDonald, who recently underwent a total left knee joint replacement and requires immediate treatment. So main purpose here is rehabilitation, which is given in the and conclusion. So intro, then past medical history. Mr. McDonald lives alone. He has a history of smoking 20 cigarettes per day and consumes 6 to 10 standard drinks per day. This is the past medical history. Then is presenting complaint, examination, investigations, diagnosis, treatment. So here the patient was actually treatment for a surgery. He was a diagnosed case of surgery. It was a diagnosed case of left knee osteoarthritis, I guess. So for that, he was planned to have a surgery, left total knee replacement. So here we don't have any presenting complaint. We are not conducting an examination or running investigations, anything. So we'll start from the surgery. So this is hospital stay actually. Mr. McDonald was admitted on this date for a total left knee replacement. Post-operatively, he experienced significant pain, managed with various analgesics, including morphine, ketamine, and amitriptyline. Then, patient's discharge medications. You can say discharge medication or maybe just simply the medications, because we are transferring the patient for rehabilitation. So definitely we will include them. We will give some kind of medication to the patient when we are discharging from here. Medications, then some plans we have for patient, like a systemic review will be conducted on day 10 and a specialist appointment is scheduled on this date. It requires extensive rehabilitation, including physiotherapy and occupational therapy home visits to evaluate suitability and readiness. Yes. So plans, everything is given here. Then is the conclusion. So this is the structure of a transfer letter. So see you in the next video. In next video we will discuss sample, intros and conclusion of different type of letters. Thank you.